Question: Chemistry of digoxin. ANS biological source: dried leaves of Digitalis lanata Ehrhart belonging to family Scrophulariaceae. Chemical major: cardiac glycoside is digoxin. Chemical formula: C41H64014. Molecular weight: 780.94 grams per mole. Solubility: sparingly soluble in water and soluble in organic solvents, chloroforms and ethanol. Ionization: digoxin can exist in both ionized and non-ionized forms depending on the pH of the environment. Appearance: white to off-white crystalline powder. Odor: odorless. Taste: bitter. Mechanism of digoxin. 1. Inhibition of NAK pump. Digoxin binds to and inhibits the NAK ADPase pump, which is responsible for maintaining the balance of Na+ and K+ ions in cardiac muscle cells. This pump normally transports 3 Na+ ions out of the cell and 2 K+ ions into the cell. 2. Increase in intracellular sodium. By inhibiting the NAK pump, digoxin leads to an accumulation of sodium ions inside the cardiac muscle cell. This increased intracellular Na concentration triggers the Na-Ca exchange. 3. Enhanced cardiac contractility. Increased intracellular calcium levels have a positive inotropic effect, meaning they enhance the force of cardiac muscle contractions. Clinical pharmacological action of digoxin. 1. Absorption. Digoxin is typically taken orally and is absorbed in the gastrointestinal tract. Its absorption can be affected by factors like food, other medication, and gastrointestinal issues. Peak serum levels are usually reached within 1 to 3 hours after oral administration. 2. Distribution, which means it distributes throughout the body's tissues with a significant portion of it binding to proteins in the blood. 3. Metabolism. Digoxin is not significant metabolized in the liver, which makes it less prone to drug-drug interaction related to hepatic enzymes. It is primarily excreted unchanged in the urine. 4. Elimination. The kidney is the primary route of elimination for digoxin. Renal function is a crucial factor in determining the drug's half-life and clearance. 5. Therapeutic effects. Digoxin is used to improve the strength and efficiency of heart contractions, making it effective in treating heart failure and atrial fibrillation. It can help control heart rate. Therapeutic uses of digoxin. 1. Congestive heart failure. Digoxin is employed to manage symptoms of CHF. It helps improve cardiac output and alleviate symptoms like shortness of breath and fluid retention by enhancing the strength and efficiency of heart contractions. 2. Atrial fibrillation. In cases of atrial fibrillation, a heart rhythm disorder whereas the atrial beat irregularly, digoxin may be used to control the heart rate. It helps slow down the ventricular response, which can be too fast in AF. 3. Atrial flutter. Similar to AF. For supraventricular tachycardia, digoxin can be administered to slow the heart rate in certain forms of supraventricular tachycardia and abnormally fast heartbeat originating above the ventricles. 5. Dilated cardiomyopathy. In some cases of dilated cardiomyopathy, a condition where the heart muscle becomes weakened and enlarged, digoxin can be used to improve heart function.